Let's talk about generalized anxiety. What do you mean when you say generalized anxiety?
Generalized anxiety disorder is when people worry excessively, and these are folks that are worried almost all the time. It interferes with their ability to go to sleep at night. They feel tired and run down the next day. They can't focus and concentrate on what they're doing because they're worried about something.
You know, sometimes we joke around about being a nervous Norvis, you know, where somebody's nervous all the time, but I can see where it would just dominate somebody's life.
And it even begins to interfere with their lives. It interferes with their job performance, it interferes with their relationships, and these folks are very uncomfortable.
How effective is the psychotherapy in this patient? Somebody that's, you know, that is just taking over their life. They're just worried about everything. How do you talk to them?
A certain type of therapy, cognitive behavioral therapy, has been shown to be very effective for these folks by itself.
Cognitive behavioral means what?
How to change the way you think and change the way you behave.
And when you talk with them about that, every person is individualized, or do they fall in a pattern?
Well, there's typically a type of pattern, and one of the things I do with folks with generalized anxiety disorders, the first things I do is try to get them to decide, am I worrying about something I can really change? And if the answer is no, maybe I should focus my attention somewhere else.
When do you decide as a physician when you want to use medications, or where you just want to continue talking to the person?
Almost always nowadays we think of combination therapy. It's the best way to go. I mean, I think the statistics will back that up. The exclusions to the rule would be somebody that you want to avoid medications for medical complications. The medicine might make the other medical conditions worse.
And there certainly are those patients too. So every patient's an individual and everybody has to be treated individually. The generalized anxiety, when does a person know that they're too nervous all the time? Are they worrying too much? Are their worrying is interfering with their life? Do people recognize that, or does their spouse or their friends or the people around them?
Well, almost always people with generalized anxiety disorder, they recognize it themselves, and certainly their family and friends and coworkers, they notice it too. And it's basically a person that worries excessively all day long and even part of the night for some of these folks.